Today we are talking about plastic surgery after pregnancy versus plastic surgery after weight loss. Can you talk to us about the key differences in the bodies that come in?
Sure. So typically with pregnancy, you got to imagine the abdomen gets bigger because you have one or two or maybe even more babies in there, and the stomach is expanded. Also, the breasts engorge for breast milk. So those are the two primary areas that are affected. But with weight loss, a lot more areas are affected. Not only the tummy, but the love handles, the buttocks, the breasts, the arms, the inner thighs, sometimes even the calves. So with obesity, all those areas typically get larger, and then with weight loss, some of the skin contracts, but a lot of that fat is gone. So the dependency or the redundancy of the skin is variable in all those areas.
And so if it's pregnancy, you don't go into it with the same surgical plan as weight loss.
Usually not. I mean, I address areas that bother the patient most.
I noticed that when you do a tummy tuck on someone after pregnancy versus someone after weight loss, the pregnancy patient, you're focusing a lot more on like a rectus diastasis, and then the weight loss, you're really removing more skin there.
Correct. So and again, it's these are big generalizations, depends on the patient, but overall, typically with the mommy makeovers, we're addressing the rectus diastasis. That's the rectus abdominis muscle, the paired muscle that goes from the rib cage down to the pelvic region, and with pregnancy, it gets stretched out. A lot of the time it goes back, but sometimes it separates, and the separation of that rectus muscle is called rectus diastasis. Diastasis is a separation, okay? So repairing the separation, getting the muscles back together and nice and flat. As opposed to the weight loss patient where the abdomen is stretched out, the visceral fat does collect, the muscle is stretched out, but on top of that, you've got a lot of fat, you've got a lot of skin, and with the weight loss, some of that skin contracts and a lot of that fat sort of melts away.